Hello, my name is Narendra Sharma. I'm an award-winning physiotherapist. Presently, I'm working as a falls prevention lead for a community trust. And then previously, I worked as a vestibular hypofunction physiotherapist in a different trust. So today, I'm just going to discuss with you some of my expertise I have gained throughout this my 10 years of span working with the cases those who have vestibular hyperfunction. So I thought, why not to share my expertise with you all as a like video tutorials. So I'm thinking to develop 5 main tutorials. Number one is the sensory integration of balance. Number two will be on the balance testing. Number three will be on the balance rehabilitation and the treatment, other treatment strategies. Number four, there will be a falls prevention, mainly dizziness as a single risk factor, and then how we can manage that risk factor for the falls prevention. And then number five, it will be the falls prevention strategies, strategies on the basis of where patient lives, whether it is in the care homes or in the acute hospitals or in the rehab units or at home. So we have got different risk factors for different care settings. So I'll be discussing that as well. Which risk factor to target depending on the level of like the way the patient stays, whether it's temporary stay or it's the permanent stay. Right. So let's start with the balance, sensory integration of the balance. That's my first video. There may be some sub videos as well when we will start. Okay, so today's first video is the balance system. See, the balance, sensory integration of the balance. So this is a little bit physiological, like heavy topic, but it's important to understand this. Okay, so number one is the balance system. When I speak balance system, we have got multiple systems. So make sure it is not a single system, it is a multiple system involvement. Okay, when we call balance system, it is just more than one system I'm talking, right? So next is, I'm just going to discuss with you is how the balance system function. So because it's a multiple system, involvement, it has 5 main aim. So these systems, they work together, and they work together for 5 main aim or goals. Okay, so what are those goals we need to understand? Okay, number one, bipedal balance, center of gravity within base of support. So when I say bipedal stance, we should be able to stand on our feet without having unnecessary abnormal postural sway. Okay, so our maintenance of the center of gravity within the base of support. That's the one function of all these systems, right? Number two is gauge stabilization. That is when head is moved in angular rotation or in the linear rotation. Okay, so make sure the accuracy of the scene world, the camera function of the eyes, right, that should be accurately performed. Okay, the scene world should fall on the fovea centralis when head is moved. It is called VOR pathway, vestibulo-ocular reflex pathway, right? So that is very important, gauge stabilization. Number three is body segment orientation. So when body is perturbed volitionally or accidentally, we should be able to maintain our center of gravity within the base of support so that we are not going out of level of stability and fall, right? That is the another function of all these systems. Number four, environment orientation. That is the location of the object when we move, that is the luminance of the environment, and that is the any depth perception issues, right? So that is one of the function of these systems. Number 5, single leg stance and safe ground clearance in swing phase. Okay, that is in our locomotion, in our gait cycle. When we are single leg stance, we should be safely able to transfer our body weight forward in our gait progression. That is one of the function. Another function, which is the gravitational orientation. So our ability to maintain our upright stance, okay, with respect to gravity, or understanding of our position, whether we are in the space or whether we are on the ground. Okay, that's one of the functions. There are further functions as well, like the control of the anti-gravity muscles as well. But these are the main 5 functions that is the responsibility of the balance systems. Right? Thank you very much. And then I'm just going to discuss now how the sensory integration of balance works. What are the systems? When I say we have multiple systems, what are those systems? Right, so I'm just going to discuss with you the peripheral systems, the central processing unit, the central systems, and systems at output level. Right, so this is very, as a physiotherapist working in falls prevention and as a balance specialist physiotherapist, I need to understand this structure, and that's always in my mind whenever I'm seeing a patient in the clinic. So we have peripheral receptors. They are the vestibular receptors or vestibular apparatus, like your semicircular canals, and then the otolith organs. Okay, then we have got joint receptors, right? The mechanoreceptors, proprioceptors, and cutaneous receptors, right? And then we have got visual apparatus. Okay, so these are the main 3 systems, those who work at peripheral level, right, and provide information about various, like sensory modalities. We will discuss them one by one, right? In the central nervous system, we have got cerebellum, we have got midbrain, and spinal pathway connections. And the cranial nerve centers. There are other areas as well, like the frontal lobe of the cerebrum, basal ganglia, and the thalamic nuclei as well. They have got their own role in the balance system as well. But these are the main, those who work with these 3 systems in the periphery. Right? And we will discuss them one by one, their role for the motor output. At the motor output, we have got oculomotor, your superior oblique, your inferior oblique, your lateral rectus, your medial rectus, your superior rectus, your inferior rectus. These are the 6 muscles. You need to have a sound functioning of these muscles, right? They are the LR6, SO4, O3, 6th abducent cranial nerve, 4th the trochlear cranial nerve, the 3rd one is the oculomotor cranial nerve. So this is how the cranial nerve testing is very important here. Right? The next one is your sound range of motion, your strength, right, and sensory system. Okay, So these are the systems responsible at the output level. So at the input level, we have a peripheral system, vestibular apparatuses like semicircular canal, and then the otolith organs. These are the main two organs within the vestibular apparatus. And then we have got proprioceptors, that is the mechanoreceptors, cutaneous receptors, and the proprioceptors. And then we have got visual apparatuses like rods and cones. And then in the central processing unit, we have got central nervous system, cerebellum, midbrain, spinal pathways and connections, and cranial nerve nuclei. And then at the output level, we should have a sound, like information about all these oculomotor muscles, as well as the musculoskeletal system as well. So this is how the whole system, like the various systems responsible for our day-to-day balance, right? I'm just going to discuss with you now one by one these systems, right? Let me remove this. So I am going to discuss with you now vestibular apparatuses and their role in the balance system, right? So we have got semicircular canal, we have got otolith organs like saccules and utricles. So semicircular canal provides information to our central nervous system via the eighth cranial nerve about the angular rotations, the information to brain about the head movements, okay, in this rotation, the angular rotation, right? So information about head is moved, so head is moved to left, so there is a deflection of the hair cells present in these semicircular canals, like in the horizontal canal, and the deflection of those hair cells will generate action potential about the information about the head is moved. Now that movement of the head is perceived by the nuclei present in the midbrain, the lateral and medial vestibular nuclei via the eighth cranial nerves, okay, the pathway called VOR, vestibulo-ocular reflex pathway, and then the midbrain further connects. Second neuron pathway is with the vestibular with the cranial nerve nuclei, okay, the lateral rectus, medial rectus, superior oblique, medial oblique, okay. So depending on the direction of the head movement, like in this rotation, in the medial rotation, right? So we are having information shared with the cranial nuclei of the medial rectus and then the lateral rectus. One will excitate, other will inhibit, okay, to get gaze stabilization. That is the accurate like pathway for the gaze stabilization, which is called the vestibulo-ocular reflex pathway, right? So the movement in the canals, right, through eighth cranial nerves to midbrain nuclei, okay, and then from here second generation pathway to cranial nuclei, depending upon which direction head is moved, and then we have got inhibition, right? So the excitation of the lateral rectus and inhibition of the medial rectus, right? So that is the reflex pathway. Similarly, we have got anti-gravity muscles as well, right? So there is another pathway through otolith organs, that is again via the eighth nerve. It is called that's called the VOR pathway. We have got vestibulospinal reflex pathway, VSR. So again, that goes to midbrain nuclei, right? And then from here, second neuron goes to via vestibulospinal pathway, which connects to the anti-gravity muscles, the tone of the anti-gravity muscles. So when head is moved left or right, it's not only the gaze stabilization, it is also the activation of your anti-gravity muscles as well, okay. That's the combination of two pathways for our postural stability, okay. So the activation of both pathway is paramount when we speak postural stability from perspective of the vestibular hypofunction. Right? The second function of these pathways is that we know, we have got otoliths, some sort of otoconias in our utricles and saccules, right? And they are responsible for gravitational orientation, right? Their movement informs our head about our gravitational orientation with respect to, are we on the ground, are we by air, or are we in the space, okay? Are we driving? So they all constantly sensing information about our, our position with respect to the environment, okay? Whether my head is bending down, looking up, or up in space. So these are the various pathways. There are a few more pathways like vestibulocolic pathway as well. So there are a few more pathways as well which you can read about, but these are the two main pathways responsible for our postural control with respect to vestibular apparatuses, okay? So their main function is when head is moved, make sure the picture of the seen world should fall on the fovea centralis, the actual center of the eyes where we have a maximum visual acuity, okay? And that's one function of this pathway. And the second is to make sure that we have got activation of the anti-gravity muscles to maintain postural control or postural tone. So this is all about the VOR and then VSR pathway. Then we have, let me delete this, okay? Then we have got mechanoreceptors present in the joint cavity. So that is the main function here is to provide our brain about position sense, right? About our segmental position sense with respect to the environment, okay? So where my body limb position is, right? That is one of the main function of these receptors, right? So this is like a unconscious mechanism, okay? The main pathway responsible for this is the dorsal spinothalamic pathway, and then the anterior spinocerebellar, and then the posterior spinocerebellar pathways. They all three work consciously, subconsciously to maintain our postural sway mechanism, right? So for instance, when I stand up after sitting, first contact with the ground is through the sole of the feet. The sole of the feet, they have got a compression, like cutaneous receptors, okay? They provide information to our central nervous system about our first information about our standing, right? Through the sole of the feet. They are very, very important pathway. If somebody has got, some sort of, crude or soft touch deficit, that pathway will be absolutely restricted, and then patient will have, some sort of postural instability because of the sensory deficit, right? So mechanoreceptors present within the joint cavities as well as in the skin, and then the other receptors like the penicillin corpuscles and then the Ruffini's apparatuses. So all those pathways, all those receptors are very, very important as well for the feedback mechanism about our joint position segmental approach. Okay, some works through the joint cavity, some works through the cutaneous compression, right? So they are like from the periphery to our spinal system, okay, dorsal spinothalamic tract, okay, to our central nervous system connections, right? And then some goes to the cerebrum, some goes to the midbrain cerebellum, but they all provide information about body segment orientation, okay? So when we are standing upright and then we are perturbed volitionally or we are perturbed accidentally, we should be able to maintain our center of mass within the base of support, right? So that is the responsibility of these receptors. Make sure they will function accurately here, okay? So therefore the testing of these receptors are very, very important, right? I'm going with the visual receptors now. So we have got visual receptors like through the optic nerve. We receive information about the luminance, about the location of the object, about the depth perception, about the contrast sensitivity, okay, about the background of the pictures. So all information is perceived by the visual receptors through um, optic cranial nerve, and then information is secondary on to your visual field area, okay, where information about all these, like what I've discussed, the depth perception, the luminous, the gauge field, all information is helped by this pathway. And then we have got, like accurate vision, gauge, depth perception, sensitivity, contrast, luminance achieved. This is all required for the balance system, right? So that is our optic pathway. So now there are few more pathways here in the central nervous system responsible for our balance system. I'll go one by one again. Cerebellum. Cerebellum is a big, it has got big supervisory role. It supervises all the input we receive from these three pathways. Okay, so make sure this is a big boss in our like balance system family. So the functioning of cerebellum is paramount. If cerebellum itself is not functioning, they all will be without a supervisor. Okay, so they cannot function without the accurate functioning of the cerebellum. So therefore the testing of the cerebellar system is very, very important. Okay, the cerebellum, what cerebellum does is it considered to be a critic of the detection of any errors, any motor errors. So it detects any motor errors, and immediately it also provides the solution, the resolution for those detected errors. Okay, so it will not only detect the motor errors or errors received from these peripheral, like receptors, but it also has ability, capacity to immediately, like resolve those errors as well. Okay, so it has got dual function, right? Detecting as well as resolving the errors received, right? So that is the main function. And then it also fine tune all the information received. If there is sometime we receive error information, right, from these peripheral receptors, but cerebellum, just without letting us know, it has ability to fine tune, so that we have got a purposeful visual control. Okay, and then we have got uh, right, so we have got a proper postural control. Okay, so cerebellum is a very important, like the main part of the balance system, which has supervisory role, and also it detects the error signals, but it also equally resolves the error signals as well. It has got one very important function as well. If there is an error in the vestibular apparatus, like in the labyrinthitis, where there is inflammation of the eighth cranial nerve, and that disturbs the gauge stabilization. Okay, the cerebellum, with the help of midbrain, quickly take over the situation and try to resolve the whole situation. It's called vestibular adaptation. You must have heard about this. So cerebellum has another role for vestibular adaptation as well, to rectify the gauge stabilization deficit caused by the labyrinthitis, which is the inflammation of the eighth cranial nerve, right? So that is the cerebellum, and then we have got midbrain as well. So let me delete that. Right? So midbrain. So midbrain, again, the main connection in midbrain is the vestibular apparatuses. Okay, basically it helps with, as I discussed before, for the gauge stabilization when head is moved. So it has got nuclei called vestibular nuclei. Plus it also a relay center for various sensory, oculomotor pathways. Pathways responsible for scaedic eye movements, which is the shifting of gaze from one object of interest to the other, or slow scanning, that is called the smooth pursuit movements, right? So it is relay center for all those, like visual control movements, not only the gaze stabilization, not only the accuracy of the VOR reflex, but also for the scaedic eye movements, for the smooth pursuit eye movements, and then holding gaze as well, right? Keeping the gaze within space as well, right? So these are the main pathways, main like systems responsible for balance system, right? So let me draw again. Let me draw systems again. So peripheral, we have got vestibular, we have got proprioception, we have got vision, we have central, we have cerebellum, we have midbrain, we have cranial nerves, right? And then we have got spinal connections, right? Here output level we have got oculomotors, and then we have got range of motion, and we have got sensory system, and then we have got MSK system. So for a information from periphery should reach into the central nervous system. From central nervous system we should have a accurate posture control. Okay, when head is moved, or when we are static, or when we are dynamic, we should be able to maintain our balance. To maintain balance, we need harmonious. None of the system works individually. Keep in mind, they all work together. Okay, some has direct role, some has supervisory role, some has role at the output level, but their input is paramount, right? So they should work harmoniously for an accurate motor output by means of bipedal stance, our ability to maintain center of gravity within the base of support, gauge stabilization, and the postural control, single leg stance, and safety whilst ground clearance in the swing phase of the gait cycle. Or when we are perturbed, we should be able to maintain our segmental orientation, body segment orientation, so that we stay within the base of support and prevent falls, that we are not going out of the level of stability, right? So these all systems, I think, very important to know their individual functioning and what happens to them if we have got faulty, so if we have faulty postural control. Okay, if we have balance problem at this level, this is what you will receive from patient, that I have problem with my balance or I'm having frequent falls. Then if you understand my, like some advice, you should have a very good understanding of all these systems so that you can rule out one by one where the deficit is. Okay, so that will be my next tutorial, how to rule out one by one to understand from where this balance hypofunction is coming. Right, that's very clear. So I will be, in a month time, I will be making some like these investigatory tutorials. There will be a one for the vestibular hyperfunction tutorial, there will be one for proprioception and vision. So I'll be speaking about these three on a separate slides, right? So you can understand how we test these systems. Okay, and then maybe forthcoming slides I may speak about cerebellum, midbrain, cranial nerves, and spinal cord connections, how to test them, and then how to test at the output level, right? So that you can plan whether that is a single system hyperfunction or it is a multiple level system hyperfunction. Sometimes I receive a referral from my ENT consultant asking this person has multiple level vestibulopathy. That can be a little bit challenging because we are talking more than one system hyperfunction. Okay, so just watch out. So thank you very much for listening me. I will see you next time in a month time with a new tutorial. Right, thank you, bye bye.